Hello, I am Ed Eichhorn. I'm the founder of Healing American Healthcare and the Healing American Healthcare Coalition. And today we're going to provide important information to you from a series of studies that my colleague John Dalton has done over the last several months, where we actually compare apples to apples. So John is going to report on the COVID-19 pandemic and how the US is doing compared with a number of other nations in the world. Let me first begin by introducing John to you. John Dalton is a fellow of the Healthcare Finance Management Association and a senior emeritus advisor at Bessler. And he's also our executive director of the Healing American Healthcare Coalition. He's a former chapter president and national board member of the Healthcare Finance Management Association, and he is the 2001 winner of the Morgan Award for Lifetime Achievement in Healthcare Financial Management. And he's the only New Jersey chapter leader to receive this honor. He also serves on the financial committee at Children's Specialized Hospital and was named the 2017 Hospital Trustee of the Year by the New Jersey Hospital Association. And at the end of this presentation, you'll see a slide with John's contact information if you'd like to ask him any questions or if you have thoughts that you'd like to share about this presentation. So without any further ado, let me turn this over to my colleague and good friend, John Dalton. Good morning, John.
Good morning, Ed. Thank you for hosting this podcast. As you can see from the slide, it says part 3. This is part 3 of a 3-part series that I've been writing for the quarterly news magazine of our professional organization's New Jersey chapter. Originally, I thought it would probably be just a 4-part series, but COVID-19 is sticking around, so I think it's going to wind up going probably into next summer. Ed and I share a mutual passion for guiding America on its path to universal health care. And over the last several years, most of my research has focused on the member nations of the Organization of Economic Cooperation and Development. Currently, there are 37 member nations. These are the countries that constitute the developed world. Sadly, the United States of America is the only member nation where its citizens do not have universal health care. We got partway there with the Affordable Care Act back in 2009, but as you're well aware, the 4 years of the Trump administration have whittled away at that so that the number of uninsured in the U.S. greatly exceeds that amount in any of the other 36 countries that are member nations. So in this article, this is part 3, I wrote the first article for our spring issue as of May 1st. We were at that point just here in New Jersey, in the New York metro area, just beginning to come down from being the global epicenter of the pandemic. Northern New Jersey, New York metropolitan area went through 6 weeks of absolute hell from mid-March through the end of April as the pandemic overfilled our ICU beds to an extent where we actually had 3 field hospitals operating in New Jersey, 1 in each in North, Central, and South Jersey. New York City had field hospitals in the Javits Center, and I think you all remember seeing the hospital ship sail up the Hudson River to dock at Manhattan. Fortunately, the hospital ship never needed to be used, but it was all hands on deck in terms of coping with the pandemic. So the first article I wrote really laid out what had been happening with the virus invading the U.S. and the entire world. And at that point in time, a lot of people were concerned about so many deaths here, so many deaths there. And we weren't really focusing on what I view as the key metrics. So I laid out the whole case for looking at the countries in terms of what's the fatality rate? How many deaths per 100,000? How is that happening over time? Where are the deaths occurring? That was the first article. The second article was written as the autumnal equinox, September 21st, for our fall issue. And in that article, I laid out again where we were in terms of the pandemic, how the U.S. compared to the other member nations. And also in that article, we spent a lot of time talking about what we've learned thus far from our experience throughout the pandemic. For example, as the global epicenter back in March and April, 1 out of every 6 hospitalized patients died from COVID-19. Today, that number is more like 1 out of 16, a 6% fatality rate. In other words, if you're hospitalized, in the New York metro area with COVID-19, you have a 1 in 16 chance of dying. That's far better than where we were in April. And that resulted from a lot of learnings, dealing with proning. You don't always have to put a patient on, intubate and put them on a ventilator. You can use CPAP, BiPAP, other methodologies to assist with breathing. So we've learned a lot. And the third article is written as of November 30th, submitted December 5th for publication. So let's take a look at where we are currently in terms of how the U.S. is performing in the pandemic. Okay, you'll see a series of charts. Now, the first chart is the COVID-19 fatality rates per 100,000 for 20 of the OECD member countries. Now, if you look at the chart, the left-hand axis is population in millions. The right-hand axis is fatality rate in deaths per 100,000. And obviously, the U.S. with 328 million people really is the most populous of the countries. Now, there are 37 member nations. In the chart, I'm just showing results for 20 that I've been tracking. I've been tracking all 37, but these are 20 that are of most interest. So on the left-hand side, you can see that New Zealand, South Korea, Japan, and Australia have coped well with the pandemic. They're all well under 10 deaths per 100,000 people. At the far right is Belgium. Belgium has been off the chart ever since I began tracking. For whatever reasons, when the pandemic first hit Belgium, their decision was to hospitalize patients from the community who had COVID-19, but they basically ignored we call nursing homes. In Europe, they're usually called care homes. So they had an enormous death rate in their nursing homes. And in fact, when they came out of the first wave, the government had the gall to brag about how well it had handled the pandemic because its ICU beds never were full. Meantime, there were body bags all over the nursing homes in Belgium. And they have continued to lead, this leads the wrong word because they're at the bottom of the barrel. They've led the developed world in fatality rates. As of the end of last month, the U.S. was in a virtual dead heat with both Mexico and Chile, the 31st place in the UK, and then trailed by the United Kingdom, Italy, Spain, and Belgium. We all remember the stories from Italy. It was actually Lombardy that got hit hardest, where Milan, again, is the global hub for people traveling to and from Italy. So Milan was hit early on and hit hard. Again, the story we keep seeing over and over again, politics over public health, that caused a lot of the high death rates in Lombardy. The rest of Italy learned from that. So they did, as you look at them over time, they did get a better control of the situation. Spain, same story. Madrid, the global hub for people traveling to and from Spain. First big spike was in Madrid. Many of the other provinces of Spain got better control of the disease in terms of prevention. And then, of course, there was us, the United States, the global hub of travel to and from the U.S. Something like 2.2 million visitors came through LaGuardia, Newark, and Kennedy during February from Europe, many of them bringing with them the coronavirus. Same thing happened in Massachusetts, with Boston, a lot of visitors coming back, bringing the coronavirus with them. There's an additional event in Boston, which we'll talk about later, and that was Biogen's early February international conference that ended up producing about 300,000 COVID-19 cases throughout the world. So looking at the chart, we've, in our 3-minute read that we publish twice a month, we've given coverage to many of these countries, but New Zealand, that island nation, has about the same population as Ireland. They're both island nations. When you look at New Zealand compared to Ireland, Ireland hasn't done a bad job, but New Zealand has just been phenomenal. Last week, for the second time during the pandemic, Prime Minister Jacinda Ardern declared that New Zealand is coronavirus free. But they've done lockdowns, they closed their borders. They realized early on that they did not have enough ICU bed capacity. They only had about 8.9 ICU beds per 100,000 people, far less than what we see throughout the EU and the US. So they had to take drastic measures, but they worked. Next up, South Korea. South Korea confirmed its first COVID-19 case the same day as the United States. South Korea not only flattened the curve, they crushed the curve. So when you look at where they are today compared to the United States, we both had the same opportunity. South Korea did very well. We're not doing so well. Fortunately, we have a couple of other folks who are doing worse than us, but when we look at us versus the rest of the world, we're not doing well. Among the 5 major Western democracies, the UK, Spain, France, Germany, Italy, we are the only one doing well all along has been Germany. We covered that early on. A lot of that revolves from the fact that they have a scientist as their chancellor. That's Angela Merkel. Understands the science, understands the politics. She came on hard and quick in terms of getting the various regions of Germany to agree to certain mitigation measures, and they worked. Germany's also where early into the pandemic, a little biotech firm called BioNTech came up with a formula. In fact, the guy who developed it did it in about a half an hour, as we're subsequently learning, and that's the one that Pfizer has partnered with and that is now being administered throughout the US, a success story. So among the major Western democracies, here's Germany right here at about 20 per 100,000 fatality rate. Ed, any questions?
Well, I think the data is very interesting. And I assume, John, and correct me if I'm wrong, the countries of New Zealand, South Korea, Japan, Australia, all acted relatively quickly and all adopted mitigation strategies to allow them to control the spread of the virus when compared with other nations around the world. Is that a reasonable assumption?
Yeah, that's a good assumption. And also, remember, these are the countries that back in 2003 were confronted with the SARS epidemic. And as you know, COVID-19 is SARS-CoV-2. It's the same basic virus, very similar. And that also was part of the reason why we were able to develop a vaccine so quickly, because so much research went on from the SARS epidemic. But the other thing is that particularly in a country like Japan, mask wearing is tolerated well. Australia, for example, you see a little bump here on this chart. They had an outbreak in Melbourne. The 2 biggest cities in Australia are Sydney and Melbourne, both about a little over 5 million people in their metropolitan areas. Melbourne in New South Wales loosened up more so than the rest of Australia and paid the price. They ended up locking down the province, actually closing the border to visitors from other provinces in Australia. But it worked. They're still doing a better job than most countries in terms of containing the pandemic. But I think a lot of what accounts for the Pacific Rim countries doing well is the SARS epidemic back in 2003 and having to deal with that. So the population already was conditioned to having to deal with a pandemic and a potentially lethal virus. The one thing that leaped off the chart to me was in the prior 2 charts I had done, little Slovakia, capital Bratislava, had been number 4 between Japan and Australia. But something popped. So I took a deeper dive into looking at the Central European countries. And here's what I found. There was 11 weeks between the 2nd and 3rd article. During that 11 weeks, we saw major spikes in the fatality rates in all of the Central European countries. So looking at the left-hand axis, that is fatality rate per 100,000. The blue bar is as of September 20th. The orange bar is as of November 30th. And you can see, just look at the Czech Republic, who have been doing quite well all along, saw a 20-fold increase in their fatality rate. Slovakia, which, as you can see, you can barely see the blue chart, they had a huge increase in fatality rates. Still doing relatively well, but a big spike. Slovenia, where the First Lady emigrated from, saw a huge increase. Even Switzerland, with its superb healthcare system and a stable government, also saw a spike. Germany, you can see Germany went all the way up to almost 20 per 100,000 fatality rate. Why? Well, as we all know, August is the month Europe shuts down and everybody goes on vacation to the south of Europe. Unfortunately, many of them brought back coronavirus. So even with mitigation measures in place, we're seeing a spike. And I heard earlier this week, the Czech Republic has gone into complete lockdown. Germany again, is having to shut down their Christmas markets. This virus can find you. It doesn't matter whether you're Democrat, Republican, or Independent, it's going to find you and it will infect you if you don't take the right precautions. Next, let's look at, back in June, I began looking at the states because we had seen the spring break start to trigger a summer Sunbelt surge. I consistently looked at the states with the highest fatality rates, the ones that got hit early and hardest, and several others. So I do mix and match what I show on these charts. But if you look at the left-hand side, once again, that is the fatality rate per 1,000. The right-hand side is the population in millions. So again, here, like as the United States did on the other chart, California is the most populous of the states on this chart. Starting with the left-hand side, Washington, the state of Washington recorded the first confirmed COVID-19 case back in January, the same day as South Korea recorded its first COVID case. Washington has a robust healthcare system and a long history of being at the forefront of developing new ways of dealing with patients. So it's a very progressive state in terms of healthcare. Even though they had that big outbreak at the Kirkland nursing home, they have been able to keep the virus under control. So you don't really control the virus, you prevent it from infecting people. And they've done a better job of that than many other states. They're still in the mid-teens in terms of fatality rate per 1,000. Move over to the far right, we start with Louisiana. Why is Louisiana up there on the chart? What happens in early February? Mardi Gras. Even in early February, the coronavirus was here in the United States and widely infecting people. So if you're on Bourbon Street during Mardi Gras, you likely wound up with a potential COVID-19 infection. Then there's the Northeast, Connecticut, Massachusetts, New York, and New Jersey. We got hammered. From mid-March to the end of April, it was just hell on wheels throughout the whole New York metro area. It got widespread coverage. But as we'll see in a later chart, once we got to understand what we were dealing with, we did a very good job of mitigation and flattening the curve. And it's still a challenge, as we're seeing now with the second surge, but we understand the disease better, we understand the virus better, and the good news is that starting this week, we're being vaccinated by the hundreds of thousands, so that's progress. Looking across the chart, you can see the beginning of that Midwest, that summer surge. So here now, all of a sudden, we've got Florida, South Carolina, Georgia, Arizona showing up with increased fatality rates. Texas, the spring break and summer surge, a lot of that resulted from the fact that many of the southern states did not undertake mitigation measures as we did here in the Northeast and in other states, Michigan, Illinois, and so forth. So that's where we were as of the end of November. Since I was going to be doing this podcast, I took another look as of the 15th. And again, we're seeing some real issue. You saw on the previous slide, there was a Sturgis, the 16th annual Sturgis motorcycle rally held in the small town of Sturgis, South Dakota, population 7,000, that ran from August 7th to 16th. It normally attracts 500,000 motorcyclists from all over the plains and Rocky Mountain and the upper Midwest states, in fact, from all over the country. This year, they refused to shut it down. They attracted about 500,000 people. Bars were packed, and then they went home. So now all of a sudden we're seeing a huge surge in the upper Midwest. What shocked me when I did the chart as of earlier this week is look who's on the chart now, right between Louisiana and Connecticut, North Dakota. They've caught up fast. Again, it's a less populous state, but the fatality rate per 1,000 is right up with us in the Northeast. And there's no excuse for that. We've had almost the entire year to learn how to deal with this, and yet they ignored all of what we learned. Other side, South Dakota. So the Dakotas, there was an article in the Times a couple of weeks ago, death came for the Dakotas, and it's still happening. My colleagues out in that part of the country, there are no ICU beds available, and in many cases, patients are having to be airlifted to other states to be treated. So we really need to learn from that. As of today, both Mississippi and Southern California reportedly have no beds available.
Yeah, there's a story I'll add at
yeah.
this point, John, because you mentioned it before, and I think it's worth discussing as you have this graph up, and that is the Biogen meeting that occurred in Boston in February. That was before a great deal was known about the virus, and it was very normal for companies to have regional or national meetings to discuss, the strategies of a company. So there were 95 people that attended this meeting in Boston, and the article that recently came out from their efforts to look at community spread determined that, as you mentioned earlier, over 300,000 people got the virus based on the 95 people that started out at that conference in February. When you think about that and compare it to the South Dakota motorcycle event with 500,000 people in attendance, the potential multiple of infection is astronomical and could affect a number of communities and states around our country. And if you looked at the daily maps that were shown in a number of newspapers in October and November, the states with the highest infection rates were the ones in the middle of the United States, from South Dakota to North Dakota, Minnesota, Wisconsin, Michigan, and other states that surrounded them that probably had visitors to the rally who intended to go despite the issue of the pandemic. And the other story that we've talked about that talks about mitigation is the comparison of Taiwan to Florida. Taiwan has a population of about 24 million, and Florida, I believe, has a population of 21 million. And mitigation was a big priority in Taiwan, and as a result, I believe at the end of October, they had 670 cases in the island of Taiwan. At the same time in Florida, the number of cases where there was no statewide effort for everyone using mitigation approaches, and beaches were open and there were a lot of people on the beaches, the number of infections through the end of October there was 830,000. So I think that example really underscores what you've been reporting on, and the idea that mitigation works, and if you don't mitigate effectively, then the infection spreads.
Yeah, speaking of Florida, there's an interesting twist on the Biogen story. That study was done by an epidemiologist from Massachusetts General Hospital. I saw it last week. They were able to trace the virus by its genome, and apparently of the 300,000 potential cases around the world, 70,000 plus of them landed in Florida. So while we all thought that spring break was what triggered the Sunbelt summer surge, Biogen might have had a hand in that also.
Very interesting.
Yeah. So finally, as long as I was doing an update as of the December 15th, I took a look at the right-hand side of our chart, the Northeast, who've been hardest hit early on, to see whether over time we've managed to keep the curve flat and keep our infection rates under control. So I ran up just a little table in Excel to look at what our fatality rate was as of the end of June. And so you can see Connecticut with 121 high, Massachusetts 117.3, New Jersey 169.1, highest in the country, and New York not far behind at 161.5. At that point, throughout the country, the fatality rate was 38.6. As of December 15th, Connecticut's at 152.5, Massachusetts 165. We just hit 200, over 18,000 dead now in New Jersey, and New York was at 182.1. The country had increased to 91.8. So you can see the difference in terms of percentage change. New York actually has done the best. There's only been a 12%, almost 13% increase in fatality rate in the 5.5 months since the end of June. New Jersey, 18.3%, Massachusetts, 40.7%. But when we look at the country as a whole, it's more than double, almost 138% increase in fatality rates. Germany, by comparison, because I always use them as a measuring stick. I'm kind of fond of the German healthcare system. And that's, they had more than doubled, but it was a doubling from 10.8 per 100,000 to 27.5 per 100,000. So it was about a 17 point difference. So the lesson, wash your hands, watch your distance, wear a mask, be careful out there. The life you save may be your own. Anything else, Ed?
No, I think that's really well done, John. Thanks for sharing your research with us. I want to invite everyone to join us on our weekly podcast, which we have for the Healing American Healthcare Coalition. And all of the information that we generally talk about in our podcasts are available through our bi-weekly newsletter, the 3-Minute Read. And you can join our coalition online at the Healing American Healthcare Coalition. And by doing so, you get a free copy of our book that describes our healthcare plan, which is the All Care Plan, that describes how we could actually provide universal health care in the United States and at the same time save our society as much as $1 trillion a year on healthcare costs. So we'd love to have you join us or send us questions and comments. As you can see, John's information slide is the last slide of our presentation. And I want to thank you for joining us today, and we look forward to being in touch with you in our future podcasts and through our newsletter at the Healing American Healthcare Coalition. Take care.